right. Good morning, everyone. It's a great day, a little bit chilly, but a great day here in Brooklyn. Certainly a great day whenever our two amazing senators are with us. They're no stranger, of course, to this borough. Senior senator lives here. Senator Gillibrand often is here. But we're particularly pleased that we're gathered here together today for this very special announcement in connection with this very special institution, the Brooklyn Hospital. The oldest hospital here in this great borough, an incredibly important safety net institution, an institution that means so much to so many here in Brooklyn. I say that not simply because I was born here, though I'm thankful that it was a successful
Many years
delivery.
after I was born. I am sad to say.
But it's a hospital that for decades, actually century after century after century, has served the people of Brooklyn so incredibly well. But we saw that. We really saw that when the pandemic first hit us hard, knocked us on the ground. And we're so thankful for the Brooklyn Hospital, for the doctors, for the nurses, for the healthcare heroes and professionals who collectively served and sacrificed in order to help the people of this borough make it through the storm of the pandemic. And while, of course, it remains with us, brighter days are ahead, and we can be thankful for the work of the people of Brooklyn Hospital in that regard, as well as, of course, our two senators and the work that we've done in the House of Representatives led by President Biden to pass the American Rescue Plan and provide the support necessary to continue to try to crush this virus. But today we are here to make a very special announcement of support in connection with this emergency room, the emergency room that was overrun during the beginning of COVID-19. We had first-rate professionals here. Those first-rate professionals and first-rate community members deserve a first-rate emergency room, and that is what $9.2 million in federal funding that we have secured will deliver. Yeah. Right. And I'm thankful for the partnership with Senator Schumer and Senator Gillibrand to make it happen. For 10 years, this is my 10th year in the House, we have not had any access to community project funding. But this year was brought back for the first time in over a decade. And we collectively decided that this institution needed to be a beneficiary of the advocacy efforts of the federal government to provide them with the support necessary to stand up a state-of-the-art emergency room. Thankful for all of the service that they provide. We have two great senators. It's amazing that we have one senator from Brooklyn who is also the Senate Majority Leader, the most powerful Democrat in the United States Senate, and one of the most important, one of three, along with Speaker Pelosi. You know, I serve in that institution.
Her birthday was yesterday.
And her birthday was yesterday, and President Biden, but one of the three most important Democrats in the United States of America, one of the most important public servants in the United States of America, who always looks out for Brooklyn, Senator Schumer.
Thank you, Hakeem. Thank you. Brooklyn is in the House, and even though Kirsten's not from Brooklyn, she has the same get-it-done persistence that we Brooklynites have. So she's an honorary Brooklynite as well. This is a great day. Our hospitals are so important to us. And when COVID hit, our hospitals suffered. Even before this congressionally directed program, CPD, we were able to get a lot of money for Brooklyn Hospital. I insisted in the last hours of the negotiations with Secretary Mnuchin from President Trump that if they didn't have money for hospitals, nothing. This hospital got $50 million originally in the CARES bill, and then another $40 million in loans forgiven. So that was $90 million. You know what these hospitals did? They just expanded, and they made room for all the people with COVID. They had to forego lots of non-emergency service surgeries and things like that which brought in the revenues that pay the doctors and the nurses and the clerical workers and everybody else. So we need our hospitals. But now so we helped them in COVID get out of the ditch. But now what we're doing, our goal has always been not just to get out of the ditch of COVID, but make things better. And that's what this $9.2 million was. And we thought it was so important. You know, the hospital only requested $5 million. But we said, no, we looked at it, and we said, you need more than that for the emergency rooms and for the triage. And we all know that a top-notch emergency room is vital to life. The number one thing that determines whether you survive when you have a heart attack or some emergency situation is how good the emergency room is. Well, they have great staff and great doctors and all of that, but they need a top-notch facility. And that's what this does. That's what this does, and that's why it is so, so important. And I do want to say a word. You know, the earmark word was a dirty word. And that's because some people took advantage of it. And they did it for things that weren't needed. The famous bridge to nowhere, no one knew where it was coming from. $200 million, only 40 people a day or a week used it. So we reformed it. Now, first, earmarks only go to not-for-profits and governments. But second, it's all public ahead of time. And we have to attach our names to it. In other words, with the bridge to nowhere, it took them months to figure out who put that in. Now, Gillibrand, Jeffries, and Schumer, alphabetical order, are happy to have our names attached to this. Because we're so proud of what it would do. I ride a bicycle every morning. I try on Saturday. I rode my bike past here. This is on my bike route. I go up Ashland and down Lafayette. And, you know, you ride through here. It has some nice hills on Lafayette. But in any case, I see how busy it is. I see how important it is to the community, not when we just show up, but just every day, because I ride by here all the time. And as Hakeem mentioned, this is the oldest hospital center in Brooklyn, the oldest hospital in Brooklyn. But it's also one of the best. We have good health care here in New York, better health care than many other places. We're proud of that. And that's because of how many people work here? 2,500 people who range from some of the best doctors around to the clerical workers who make sure all the paper is kept, to the janitors who come in late at night and keep the place spotless. So it's an employment center as well. And one other point, we not only have the majority leader here, but we have the head of the Democratic caucus, the fourth-ranking member of Congress. So we got a lot of, between Kirsten and Hakeem and myself, we have a lot of clout for Brooklyn and New York. And you may have seen there's a story in the New York Times today. Because of the work we've been able to do, for the first time, Senator Moynihan, who was a mentor to me, used to decry that New York is a donor state. In other words, we sent more money, considerably more money to Washington than we got back. Last year, in last year's budget, and it'll continue this year, is the first year we are a donee state. For every dollar we sent back, we got $1.59 back. And in part, that's because you have a delegation here, a majority leader, a hardworking senator who has great committee positions, and the head of the Democratic caucus in the House who are fighting for New York, and we're proud of that. So with that, let me introduce someone who's a dear friend. You give her a job, she gets it done. And I give her a lot of jobs, and then she comes up with many more on her own. Kirsten Gillibrand.
Well, thank you. Well, thank you to Senator Schumer. Hakeem's quite right. Senator Schumer is, next to the President and Speaker Pelosi, the most important and powerful Democrat in the country. And having that leader be from Brooklyn and from our state is a true blessing, because he can really guide legislation and guide investments in a way that helps New York in exactly the way it needs to be helped. It also matters that he does take a bike ride throughout his community every day, because he gets to see exactly what's needed, what's most urgent, and what we have to work on to help people the most. And working with Hakeem is a pure pleasure. He's somebody who understands his district very well. He understands the greatest need and the greatest good, and that's why we came together to do this hospital investment. I also want to recognize the dignitaries here with us. I'm very grateful to be with our CEO and President Gary Taranini, as well as Chair Lisanne Fontaine. Thank you so much, Chairwoman, along with the doctors and nurses and staff that are here. This is a really important day for this community. As both of our elected leaders have said, this hospital was on the front lines of the pandemic. This hospital during the pandemic had 90% of its beds filled the entire time. It was one that had great strain placed on it. And this hospital has a storied history, as Senator Schumer mentioned. The Brooklyn Hospital Center was here treating wounded soldiers during the Civil War. It was here when people who are constructing the Manhattan Bridge became ill because they got the bends. This has been a hospital that's been here for the community ever since.
It was here when the Brooklyn Tech kids came here depressed because they flunked their exams.
Yes.
Did you go to Brooklyn Tech?
And that too. And that too.
It's right there.
So having this hospital be able to be invested in really does make a difference. As Senator Schumer said, these resources will go to funding the emergency department modernization project. It will create enhancements like new equipment, improvements like an observation unit, additional support space, and a morgue renovation. This project to develop a new state-of-the-art facility will help expedite the registration process, getting patients from the waiting room to the treatment room more efficiently, transforming the hospital's response time and process for traumatic injuries and illnesses. We also recognize that the Brooklyn Hospital Center provides critical services such as all healthcare, regardless of their insurance status, and that makes us very, very proud. So I'm grateful to be here among my colleagues and among these great leaders to celebrate today's victory. Thank you.
Thank you.
Thank you so much, Senator Gillibrand and Senator Schumer. It is now my honor to introduce Gary, who's the CEO of this great institution and has been a tremendous leader, particularly during these times of trial and tribulation and turbulence. CEO Gary Taranini.
Thank you. I just want to say, I think it was pretty much said for me, but we do have, we want to welcome, in our minds, these three folks are the best that we have. And I can tell you, you know, we are the oldest hospital in Brooklyn.
Right.
We go back to 1845, back to the Civil War, the 1918 pandemic, Spanish flu.
Right.
We were here, and now we've been here with the most recent COVID pandemic. So we fought through all of that. We're still here today for our community. And it's very symbolic because when I look at these three people here, it's what they've been doing for us. I know particularly during COVID, we've had, here you go. Come on in, guys. Come on in, guys. We love our nurses. And these are the most important people right behind me, by the way. But anyway, it's just amazing, you know, kind of running this institution, a storied institution, and then knowing that I was talking to these folks during the COVID, and to have them behind us and have our back. You know, we are a safety net hospital, so I think the monies that we're getting, 9.2, it's just amazing. We can't believe it, but we need monies to finish the emergency department. We need so many things to have done here that this 9.2 is really well received. And I can't say enough about these three folks, and we're just thankful that we have you three fighting for us. And it's very symbolic because it reminds me of this hospital and how we fought through this for the last 177 years. These folks are fighting for us every day. They're fighting for New York, and they're fighting for its constituents. And it's obvious what they did for us that they're doing that. So I just want to thank you three. And these are our best three in Washington right now. So thank you so much.
Thank you,
Senator.
Doctor.
Thank you.
And now our final speaker, the chairwoman of the board of the Brooklyn Hospital Center, Lisanne Fontaine.
And that means she puts in a lot of hours and doesn't get paid.
I'm just going to start out with a shout out to the nurses behind me. I'm a nurse myself.
Oh,
so
nice.
I'm particularly glad that they joined us. Thank you for being here. This is a great day for Brooklyn Hospital. Brooklyn Hospital has a long, proud history. including being the site of Congressman Jeffries' birth. And thanks to Senators Schumer and Gillibrand and Congressman Jeffries, we have a bright future as we continue our work of knowing and partnering with this community to promote and ensure its health. As many of the remarks have referenced, in the tragedy that was the pandemic, there was a silver lining. It allowed us to show ourselves what we were capable of and show the community and the world at large. Within days, we built a tent, we repurposed some of our equipment to get results more quickly, and we watched with awe and pride as our doctors and nurses stepped up to the challenge of a lifetime. So in closing, I just want to thank the elected officials who are here for the incredible work you've done. I know I speak on behalf of my board, several of whose members are here, when I say a heartfelt thank you. Thank you.
Thank you.
Thank you.
Thank you.
Yay. Oh, the big check.
And now, the moment that we've all been waiting for.
Come on up.
Come on up. First of all, we're just thankful for the doctors and the nurses who have joined us, and these wonderful, amazing nurses for their work and what they've done, their care and their compassion. This is a hospital, the Brooklyn Hospital serves the least, the lost, and the left behind, the poor, the sick, and the afflicted, and do a phenomenal job. And it's because of people like those who are standing with us today. You've stood with us, and now the federal government is standing with you to present this check.
And we love our nurses. They are the nicest people. If you took a class, no, they are. Nurses are always nice. It's amazing. And one other thing I wanted to say, the teamwork. So Hakeem asked for $5 million. We could have just said, let's just do the 5. We added another 4.2, and that's why teamwork matters. And that's how the number got up to 9.2. Very much needed, but it'll be expanded. Not just, the emergency room, but all the surrounding activities as well. So you'll have a great new place to work.
All right, so the check reads, we've got the House seal and we've got the Senate seal. Make sure everybody's well represented on this check. Paid to the order of the Brooklyn Hospital Center, United States Government, 2022 Community Project Funding, $9,200,000.
Big deal. Wonderful.
Okay,
Thank
great.
you.
All right, good job.
Nice job. Well done.
Take a picture with you guys.
Yes.
Senator Gillibrand.
Yeah. Let's all get in.
You want to still have the...
Yeah.
Great, all right.
Hold on to.
Thank you. Now I can see you.
We have a Brooklyn Dodger hat right there. They may have come here. I'll bet some Brooklyn Dodgers were here.
Right here, Chuck?
Sorry.
I'm sorry, I need to stop for 1 second. I need my photographer in the middle. Get here.